हाय दिस इज हार्टी संदूल मेरा नवा गाना साइको फ्रॉम माय लेटेस्ट टीवी प्लेजर्स सुनो स्पॉटिफाई पे
Hey, and welcome to the Spotify Tips and Tricks podcast, where you can browse our tutorials, get answers to your questions, and find new ways to make the most of the Spotify app. You might even discover tips, tricks, and features you didn't already know about that'll make your Spotify experience so much sweeter. Follow our new podcast on Spotify.
Managing Director, Apollo Hospitals Group. Ms. Sinduri Reddy, COO, Southern Region, Apollo Hospitals. Dr. K. Hari Prasad, President, Apollo Hospitals Division, Apollo Hospitals Group. Mr. P. Shivkumar, Head of Apollo Hospitals, Delhi. Dr. L.R. Sharma, Director, Medical Services, Apollo Hospitals, Delhi. And Dr. Gaurav Katyal, Vice President, Operations, Apollo Hospitals, Delhi. We also have the most important people who've been working on these projects with us. Dr. Anupam Sibal, Group Medical Director, Apollo Hospitals Group, and Dr. Rohit Bhojraj, Head of Pediatrics, Apollo Children's. We would also like to welcome Mr. Sriram, CEO, Apollo Health and Lifestyle Limited, Mr. Anubhav Prasad, COO, Apollo Cradle, and Dr. Vijay Agarwal, Medical Director, Apollo Health and Lifestyle Limited. We have amidst us a very cute group of kids right here in front who are our health ambassadors this afternoon. Welcome, guys. And we have with us our viewers who have also joined us online through YouTube. We welcome you to the launch of a highly anticipated National Pediatric Program, a new chapter dedicated entirely to the well-being of our children. It fills our heart with joy and gratitude to witness the culmination of the tireless efforts, unwavering dedication, and a shared vision to create a haven of healing exclusively for our little ones. What started with the vision of one pioneering gentleman 40 years ago is today a legacy of unwavering commitment, of innovation, compassion, and tender loving care. I'm sure you're all aware of India's first pediatric liver transplant, which took place at Apollo Hospitals way back in 1998. A 1.5-year-old Sanjay then had become the beacon of hope for thousands of other such patients. Today, this person, 25 years later, himself is a doctor, spreading his blessings amongst the needy. Along this remarkable journey of 4 decades, Apollo has, with the blessings of Almighty and the vision of its senior leaders, crafted a sanctuary to support the dreams of many such kids. So many of them have found a second chance at life, so many dreams realized, hopes restored, and lives transformed. We believe that every child deserves a future full of promise and endless possibilities, and with this program, we aim to make that a reality. Thank you for gracing us with your presence today. So I would like to start the program by giving you a simple overview of why do we need pediatrics as a specialty. I would like to request Dr. Gaurav Katyal, Vice President Operations, Apollo Delhi, to take us through this.
Namaste and good afternoon, everyone. Of course, we are the most populous country in the world now, which also means that we have a huge proportion of population which is less than 18 years of age. With 450 million of them, our children make up in a human baby against number of bones which are present in a human adult. So this is only for the non-medicals present in the room. So can somebody make a guess? Any guesses on adults versus babies? So I'll just wait for another 5 seconds. Anybody volunteering? Okay. So does she know? Okay. So I'll tell you, a human baby has got 300. So you can see the difference between the anatomy. But be it their anatomy, physiology, immunology, psychology, or their metabolic and development needs, everything needs to be customized for children. Apollo has pioneered in attending to those needs by creating special clinical programs, infrastructure, and support for complex care. So under the guidance of our beloved chairman, we have led the pediatric care program in the country, And let me share some data points. We provide world-class pediatric services in more than 40 locations through more than 900 dedicated pediatric beds, including 200 neonatal. Over, uh, over the past 40 years, we have been able to treat more than 3 million. This will help us in providing standardized pediatric care in every Apollo hospital. And it is our vision that every future facility that we build will have a separate dedicated facility for children. We are consolidating our efforts to this end. Thank you for your patient hearing. Thank you.
Thank you, Dr. Gaurav. So it's abundantly clear that our kids definitely need separate care from what we provide to our adults. But why Apollo? What gives us the differentiation to be the best in the market to take care of your kids? Who better than the Group Medical Director, Apollo Hospitals Group, to take you through it? So may I please welcome Dr. Anupam Sibal.
Good afternoon, everyone. Namaste. Thank you very much for finding time for us. This is truly a very special event. As I see Ahilya and Yuvan and Saina and Shiv and Tenzin and Hans, Ahana, Atharv, and Loreen. Thank you very much for finding time, for joining us as we share this program with you. Big thank you to the teams that have made this possible, to our friends from media, and of course, our chairman, Dr. Reddy, Dr. Preeta Reddy, Ms. Sunita Reddy Sinduri, for all the support. So I'm just going to walk you through a presentation for a few minutes. And while we take great pride in looking after healthy newborns, we look after premature babies as little as 500 grams born at 25 weeks. We look after children for their vaccination. We look after adolescents, and for those who have adolescents know that is really, really trying. And we deal with all the issues, and of course we deal with some bumps and falls and some stitches, as some of you know. But more importantly, we also aim to give hope to those that really are struggling. For example, this child, Mahendra, is from a small village in MP, and he's seen for his entire life the world upside down. He could not straighten his neck. He has a rare condition called Nemelin-Rod disease. And this is him after surgery, seeing the way everyone sees the world. These are Abriana and Adriana, conjoined twins. as we expected. We actually did, for the first time, a procedure in the world to embolize this malformation, and this is this baby, Shakti, a few months later. Here is a child who came to us for proton therapy, had a rare brain tumor, craniopharyngioma, and he became the first child in India to undergo proton therapy. And proton therapy is a very advanced way of managing cancer through radiation, and there's only one machine like this in South Asia, and that's at Apollo Proton Cancer Center in Chennai. We take on some very, very challenging cases. This is baby RC, and she came to us from Manila, and you can see that she's so severely malnourished. She has a huge belly. She has pronounced liver failure. This is RC after her liver transplant, and this is RC 4 years later. I met her in Manila, and she's full of energy, going to school and leading a normal life. And this is a baby who came to us from Tanzania, and when we transplanted her, she wasn't even 4 kilos in weight. So she was the smallest baby who underwent a liver transplant, and this is her a few years later. This is Sanjay. Sanjay got referred to us from Kanchipuram. He was 20 months old, and he came to us in 1998 with biliary atresia condition, which is seen in 1 in 12,000 babies where they develop jaundice after birth. And this jaundice progressively gets worse. They develop liver failure, and he came to us with liver failure. And you can see that he's very severely malnourished, deeply jaundiced. He became the first child in India to undergo a liver transplant. His father was the donor. And Sanjay got transplanted in November. This is Sanjay a year later at the All India Transplant Games. And this is Sanjay, who himself now is a doctor and works as a resident in Apollo Hospital, Bangalore, 24 years later. So we are here to be able to help such families. We now have 25 subspecialties in pediatrics for every organ system, depending on age specialization and specialty specialization. We've done more than 2,000 pediatric cardiac surgeries, more than 600 robotic surgeries in children, and more than 500 pediatric liver transplants. But the important thing about pursuing clinical excellence is to pass on this whatever you learn to colleagues elsewhere, and so it's extremely important to get involved in research publications, and we have now, between all our faculty, more than 2,500 publications in peer-reviewed scientific journals. And it's extremely important to pass on this mastery to the next generation. So we take pride in the fact that we have 49 DNB and FNB pediatric trainees every year. So 150 young pediatricians train in different specialties, and after 2 or 3 years can go on and become specialists and provide care to the community. To make sure that everyone gets updated, we are launching two programs. It's called Perivans, which is CMEs for practicing pediatricians, and you'll be surprised to know that there are 33,000 pediatricians in India. And we are also launching a program called Perivision, which is for postgraduates. So every month we'll be doing very large online programs, and these will be led by Dr. Ramesh and Dr. Vijay, who both served as past presidents of the Indian Academy of Pediatrics. O.S. Madan had said, there is no medicine like hope, no incentive so great, and no tonic so powerful as expectation of something better tomorrow. And I think that's what we're hoping to do, is to give hope to families with children who today have no hope. And we'd like to thank you for being our partners as we progress in this journey to protect our future children of our country and make them healthy young adults. Thank you very much.
Thank you, sir. It's always so overwhelming to see small kids in pain and going through so much, and then so heartwarming to realize that we have made a difference to their lives and to their families. Let's hear more from Ms. Sunita Reddy, Managing Director, Apollo Hospitals Group. She's joining us virtually. So can we have her, AV, please?
Good afternoon, everyone. here we look at prevention as well as what we can do in terms of correcting any malformations. I think this is a very important step in the journey of Apollo. For many years, we have focused, and Anupam has really taken you through those slides where we've done the most difficult of surgeries. And we've done this because of our commitment to children and to the future of our nation. But today we stand here launching this program that looks at the journey of a child from the time he was conceived, he was born, becomes a teenager, and then a young adult. And this is an area where we have always been passionate about, and that's why you can see many of our family members here. It is true passion for this space. Currently, so what have we given it in terms, what have we invested in terms of, we have built infrastructure, we have 900 beds dedicated for pediatrics. We have, more importantly, 400 pediatricians within the system. We have, we've got subspecialties, and this is where you talk about comprehensive pediatric care. We're not just about fixing the broken bone or the heart with a hole, but we go beyond that to looking at vaccination programs, to look at preventive health, and also to look at the very extreme end where, you know, Anupam showed you that slide of a child from Proton. Apollo is willing to make these investments because we care about clinical outcomes. We are willing to make these investments because we care about the future of our next generation. From the inception, if you walk into our, what you see in each of the walls, all of this has been designed for the child, and is vastly different from what you would see in an adult facility. Going from neonatal to pediatric ICUs, I think there is a huge amount of clinical differentiation, and this is the core of Apollo, what we do in terms of clinical differentiation. I'm very proud to be part of this team that is today dedicating the whole pediatric effort and dedicated it towards better clinical outcomes, to keeping your child healthy, and also to look after the mental health of children, which is becoming a huge problem. Having said this, I draw inspiration from the work that has been done before, and let me tell you this small story. So all of you would have heard of Lionel Messi. At over 30 years, he won a World Cup. When he was a child, he was detected with a deficit growth hormone. And for the rest of his life, he had to be treated with doctors, pediatricians, and everyone is witness to what he became. I think many of our children, each of our children has the potential to do so much more. And this is what Apollo gives you today, the infrastructure, the backing, the doctors, so that we are part of your journey in becoming a hugely successful adult, remembering that our children are ancestors to the future generation. So we must do our best, and we are inspired by what more we can do to build the future of this country. Thank you, ladies and gentlemen.
Thank you, ma'am. It's always so inspiring to hear your vision. May I now request Dr. Preeta Reddy, Vice Chairperson, Apollo Hospitals Group, to share her thoughts with us.
Thank you all so much, and namaste. When I look back on the journey, it all started 40 years ago when, Chairman said we need to do something for our country, and especially for patients who are not able to travel abroad. And the journey has been very rewarding, and we've been able to do so much in different aspects of care, whether it is real tough interventions or if it's in the area of prevention or even research. But having said that, we have realized over the past years that children are precious, children are the future, and parents find it very difficult to get a comprehensive care center for their children. And while we had pediatric departments within the hospitals which we built, we realized some time ago that, one is that we can have standalone a few centers for pediatric care. But also, if we bring the network together, if we bring the expertise of our 400 clinicians, if we bring protocols and the way we do things for all these 900 beds which we've created, we can actually make the level of care seamless. We can really make a difference in the way the outcomes come about. And I think to us, that has probably been the most rewarding. You saw some slides of the kind of work we've done. Well, our cardiac program works with some of the best centers globally. And now we've embarked on trying to handle pediatric cancers. And while that is a tough journey, I think it needs to be undertaken. Simply because that, children from our country can't really afford to go abroad to the centers which they need to go. And then there is another huge area which is a growing area. One, of course, is in the space of mental health. And I think the teams are coming together to see what can we do. And we still do not have enough in our country for, diseases like autism or some of the genetic disorders which are prevalent globally. So while we are doing the stuff which we have become experts at, we're also looking at other areas of pediatric care which really need a lot of focus and which we should be able to do things to help children and the parents, of course, who come to us. We've worked very closely with some of the global centers of renown, one being Sick Kids in Toronto. They work together, the clinicians interact, they have a second opinion and expert services. GOSH, which is the one in London, the nurses have gone there for training and the doctors have gone and they have interacted. And then Philadelphia, Anupam spoke to you earlier, but he himself is so involved with the Children's Hospital in Philadelphia. So what our aim is to bring, whatever is possible globally within our country, within our healthcare system, and see that in every city where we are present, that we will ensure that the best class of care is there and available to the children. There's a lot happening in the space of research, and I think just focusing on pediatric care will help us then get the data together so that we can get better outcomes for these children, because these genetic diseases, even now, we really don't have too many answers. And if we can invest in that with time, effort, manpower, and energy, we will have answers for some of the diseases which, with early interventions, can make a huge difference in children's lives. I think all of us are here today to see how can we make a difference. And the special focus on pediatric care, the special focus on all the clinicians coming together, the network coming together, that these children who really need an intervention, a healthcare intervention, can have a better tomorrow. So I'm so glad that the team has put this together and that the network is coming together, because sometimes size really matters, scale really matters, because we have that many more brilliant minds to be able to do something for these children. So every child will have the power of our 400 clinicians who are there throughout the network, helping them to get better. So thank you all for being with us today. And a special thanks to these beautiful children who we all know, either they were born with us or they have been looked after by our pediatricians, but or treated by some of our doctors. Thank you all, this special group of kids who've come to launch this program for us, because you really are our tomorrow, and you're the ones who are going to make a difference in this world. So thank you, and God bless you all.
Thank you, ma'am. You made such an important point that there's so much data to be collected, so much research to be done, so that we know exactly what to provide as treatment. So now moving on, we'll go to the most important phase of this event, which is unveiling the brand logo. And may I request the kids, the stars of this event, to please come here And Dr. Sibyl and Sharma kindly join us. Thank you so much, Ahilya, Saina, Yuvan, Atharv, Ahana, Hans, and Lareen. Thank you, kids, for that beautiful photo op. Thank you so much for being here. We'll move on, and we have a pre-recorded message from Chairman Dr. Pratap C. Reddy. Unfortunately, he could not be with us here. So please kindly play the AV.
Namaste. I'm very happy to see all of you today to join another major milestone of Apollo Hospitals. Apollo Hospitals has given a mission to provide the best possible care for all people. And when it comes to the little ones, the children, from day one we paid special attention to the children and started the children's hospitals and then mother and child. Today, the mother and child hospitals, which we started 2 decades ago, called Cradle, have become synonymous with great care for the pregnant women and the newborn. This is, the enthusiasm that we had, that we need to cover the entire, from pregnancy to the newborn, to adolescents, and to the adults and the geriatricians, has been our mission from the beginning of Apollo 4 decades ago. I'm happy that we have shown clinical excellence by providing close to 1,000 beds for children, several hundred pediatricians, various specialties. Started with children's heart, children's transplants, which is very significant. I think we have done the largest number of liver transplants. I still recollect the young boy who had a liver transplant in Delhi almost 2 decades ago. And this is what makes us feel happy, that we have done more than 500 pediatric transplants from all over the world. Several other countries. I think Philippines celebrated their 100 liver transplant program a few weeks back. I think this shows the Apollo's commitment from pregnancy to this really shows our dedication to the entire people of our country, and why not for the rest of the world who are already coming to us, more than 150 countries. And I used to call it saying, India is now ready to become global healthcare destination, and our government now turned it saying, we'll make call it a Heal in India. I think I'm proud. Many achievements, not just of Apollo, of the number of good specialties that are developed by over 300 hospitals across the country, makes us say India today is ready to be ahead of any country in providing total care and specialized care, subspecialties in all of this. I congratulate the entire team of doctors, the nurses and the supporting staff, and of course the management, not to talk about the state-of-the-art technology that we have provided from day one to each one of these disciplines. I would like your good wishes and to see that this grows and becomes synonymous with Heal in India. God bless. Namaste. I'm very happy to see all of you today to join another major milestone of Apollo Hospitals. Apollo Hospitals has given a mission to provide the best possible care for all people. And when it comes to the little ones, the children, from day one we paid special attention to the children and started the children's hospitals and then mother and child. Today, the mother and child hospitals, which we started 2 decades ago, called Cradle, have become synonymous with great care for the pregnant women and the newborn. This is, the enthusiasm that we had, that we need to cover the entire, from pregnancy to the newborn, to adolescents, and to the adults and the geriatricians, has been our mission from the beginning of Apollo 4 decades ago. I'm happy that we have shown clinical excellence by providing close to 1,000 beds for children, several hundred pediatricians, various specialties. Started with children's heart, children's transplants, which is very significant.
It's your vision that has led to Apollo being synonymous with excellence. We'll bring the session to an end with a word of thanks from Dr. L.R. Sharma. Sir, may I have you here? He is the Medical Director of Apollo Hospitals, Delhi.
Good afternoon, namaste. dignitaries participating in this program through virtual mode as well as physically here, like Anubhav, Dr. Anupam Sibal, distinguished guests, lovely children, their parents, friends from the media, and ladies and gentlemen. It's my honest task to propose a vote of thanks. So on behalf of Apollo, I would like to thank you for joining us on this momentous occasion of the launch of Children's Pediatric Center for Children Health. And this has been possible because over last 40 years, the families have put their trust and faith in Apollo group of hospitals, and you have seen some of the excellent outcomes, some of the outstanding achievements which have been listed by Dr. Anupam, and as well as over 40 years, there are many more to be listed. So we thank the families, our clients, that they have put their trust and faith in us. So at the foremost, we are really grateful for the children and for their parents who have put their faith in us, and for your presence today here. Now, when you launch such an event, there has been a teamwork behind this whole program. And many people get involved in it. But there has to be somebody who has got the vision and who had the foresight to create such a facility. And this, as you've already heard, 40 years back, our legendary chairman, Dr. Pratap C. Reddy, was the one who had. We welcome our Managing Director, Mr. Shiv Kumar here. Thank you for your presence, sir. So I was about to say that it was the chairman who had a vision. And we are extremely grateful to him for creating such a world-class facility, not only for children now, but for whole of transforming the healthcare landscape of this country. And this is the culmination of those 40 years of experience that today Apollo is in a position to think exclusively creating a chain of hospitals for the welfare of children, where we are going to provide all kind of facility to these young kids who are the future of this country. So I really, all of us join here to pay tribute and thank our chairman for this vision. Now, when you have a vision and you have a direction and a foresight, then this has to be given a concrete shape. And as you heard, Dr. Preetha Reddy, our Vice Chairman, Apollo Hospital Group, and Miss Sunita Reddy, Managing Director, Apollo Hospital Group, they are the ones who have given direction to his vision and to his foresight. And I'm really grateful for them for blessing us and joining us virtually during the launch of this program. In addition, we had Miss Sanduri, though she is not been able to participate here. She is the one who has been giving the energy and the enthusiasm to put into play. She is the director of the Apollo Group operations head, and she is the one who is responsible taking it forward. So we are really grateful to all these ladies and of our chairman. In addition, of course, we are thankful for our Managing Director, Mr. Shiv Kumar, for taking time out from his busy schedule, and Dr. Anubhav from Cradle CEO, and other invitees who have come here. Thank you very much. Of course, the driving force behind what Apollo's pediatric care today is our Group Medical Director, Dr. Anupam Sibal. He is the driving force behind this program and the pediatric care in Apollo hospitals. So thank you, sir. Thank you very much. Thank you very much. It has been really inspiring. It has been inspiring. And well, last but not the least, it is the Apollo team, the Apollo Hospitals team. It is through their relentless efforts and dedication that you have seen the culmination of this event as it is today. Their untiring efforts and the unwavering commitment to create a kind of excellence in healthcare, to be innovative in providing treatment to our patients and creating this kind of facility. We are really thankful to each one of them, being team event, you know. They are the ones who have been able to create this today. In the end, I thank each one of you. Yeah, of course, Miss Sangeeta Shin, she wasn't here, so I thought she, the ones who were given us the blessing, she continues a very great source of inspiration, inspiration. And so are many of us. I agree. There may be some whom we are not able to probably forget or not mention here. But as I told you, the whole of Apollo Group is a teamwork. But one man's vision. And that man, I told you, is the chairman. And of course, many of you, including our MD, including Dr. Anupam Sibal, are the people, Anubhav and others, who have been carrying forward this program. So we really express our gratitude, each one of you. And of course, it is the each one of you who is present here deserve our grateful thanks. We are really obliged. It is you people who have made this event possible. And we remain ever grateful for you, for reposing your trust and faith in us. And as we go forward, let's rededicate ourselves to creating a facility for our children who are the future of this country, where every child gets the best of health care, which is available anywhere in the world, should be available in this country, and brings a smile to his face. And whenever you see your children smiling, it gives you a great joy. So thank you again, and have a wonderful day ahead. And I'm sure the stacks and the few. Thank you.
Thank you, everyone. You've been a very kind and patient audience. So the event is over, and may I request you to now join us for lunch.